Video of mine is about polyhydramnios, and that is the excessive accumulation of amniotic fluid. This is the fluid that surrounds the baby in the uterus during pregnancy. Polyhydramnios occur in about 1 to 2% of pregnancies. Most cases of polyhydramnios are mild and result from a gradual buildup of amniotic fluid during the second half of pregnancy. Severe polyhydramnios may cause shortness of breath, preterm labor, or other signs and symptoms. If you are diagnosed with polyhydramnios, your healthcare provider will carefully monitor your pregnancy to help prevent complications. Treatment depends upon the severity of the condition. Mild polyhydramnios may go away on its own. Severe polyhydramnios may require close monitoring. Earlier, I posted a short video about polyhydramnios on this channel. I hope you have already seen that video, and today I am going to discuss this condition in detail. Well, first of all, let me tell you the symptoms. Polyhydramnios symptoms result from pressure being exerted within the uterus and on nearby organs. Mild polyhydramnios may cause few, if any, signs or symptoms. Severe polyhydramnios may cause shortness of breath or the inability to breathe, swelling in the lower extremities and abdominal wall, uterine discomfort or contractions, fetal malposition such as breech presentation. Your healthcare provider may also suspect polyhydramnios if your uterus is excessively enlarged and he or she has trouble feeling the baby. And now I'll tell you the causes. Some of the known causes of polyhydramnios include a birth defect that affects the baby's gastrointestinal tract or central nervous system, maternal diabetes, twin transfusion, that is a possible complication of identical twin pregnancies in which one twin receives too much blood and the other too little, a lack of red blood cells in the baby, that is fetal anemia, blood incompatibilities between mother and baby, infection during pregnancy. Often, however, the cause of polyhydramnios is not clear. Now I'll tell you the complications. Polyhydramnios is associated with premature birth, premature rupture of membranes when your water breaks early, placental abruption when the placenta peels away from the inner wall of the uterus before delivery. Also, umbilical cord prolapse can take place. In this case, when if the umbilical cord drops into the vagina ahead of the baby. And then there could be need of C-section delivery. Also, stillbirth can take place. Heavy bleeding due to lack of uterine muscle tone after delivery can also occur. The earlier that polyhydramnios occurs in pregnancy and the greater the amount of excess amniotic fluid, the higher the risk of complications. Now I'll tell you about the diagnosis of polyhydramnios. Well, if your healthcare provider suspects polyhydramnios, he or she will do a fetal ultrasound. The test uses high-frequency sound waves to produce images of your baby on a monitor. If the initial ultrasound shows evidence of polyhydramnios, your healthcare provider may do a more detailed ultrasound. He or she will estimate the amniotic fluid volume by measuring the single largest, deepest pocket of fluid around your baby. An amniotic fluid volume value of 8 centimeters or more suggests polyhydramnios. An alternative way of measuring amniotic fluid is measuring the largest pocket in 4 specific parts of your uterus. The sum of these measurements is the amniotic fluid index. An amniotic fluid index of 25 centimeters or more indicates polyhydramnios. Your healthcare provider will also use a detailed ultrasound to diagnose or rule out birth defects and other complications. Your healthcare provider may offer additional testing if you have a diagnosis of polyhydramnios. Testing will be based on your risk factor, exposure to infections, and prior evaluations of your baby. Additional tests may include blood tests. Blood tests for infectious disease associated with polyhydramnios may be offered. Amniocentesis, and this is a procedure in which a sample of amniotic fluid, which contains fetal cells and various chemicals produced by the body, is removed from the uterus for testing. Testing may include a karyotype analysis used to screen the baby's chromosomes for abnormalities. If you are diagnosed with polyhydramnios, your healthcare provider will closely monitor your pregnancy. Monitoring may include these tests, which I am going to tell you now. Non-stress test. This test checks how your baby's heart rate reacts when your baby moves. During the test, you will wear a special device on your abdomen to measure the baby's heart rate. You may be asked to eat or drink something to make the baby active. A buzzer-like device also may be used to make the baby and encourage movement. Biophysical profile. This test uses an ultrasound to provide more information about your baby's breathing, tone and movement, as well as the volume of amniotic fluid in your uterus. It may be combined with a non-stress. Now I'll tell you about the treatment. Mild cases of polyhydramnios rarely require treatment and may go away on their own. Even cases that cause discomfort can usually be managed without intervention. In other cases, treatment for an underlying condition such as diabetes may help resolve polyhydramnios. Well, and if you experience preterm labor, shortness of breath, or abdominal pain, you may need treatment, potentially in the hospital. The treatment options may include drainage of excessive amniotic fluid. Your healthcare provider may use amniocentesis to drain excessive amniotic fluid from your uterus. This procedure carries a small risk of complications, including preterm labor, placental abruption, and premature rupture of the membranes. Medications. Your healthcare provider may prescribe the oral medication indomethacin that comes with the name of Indocin to help reduce fetal urine production and amniotic fluid volume. Indomethacin is not recommended beyond 31 weeks of pregnancy due to the risk of fetal heart problems. Your baby's heart may need to be monitored with a fetal echocardiogram and Doppler ultrasound. Other side effects may include nausea, vomiting, acid reflux, and inflammation of the lining of the stomach, that is gastritis. After treatment, your doctor will still want to monitor your amniotic fluid level approximately every 1 to 3 weeks. If you have mild to moderate polyhydramnios, you will likely be able to carry your baby to term, delivering at 39 or 40 weeks. If you have severe polyhydramnios, your healthcare provider will discuss the appropriate timing of delivery to avoid complications for you and your baby. Polyhydramnios can be worrisome finding during pregnancy. Work with your pregnancy care provider to ensure that you and your baby receive the best possible care. Okay. Well, this was my video about polyhydramnios. If you have any question about polyhydramnios, you can ask me in the comment section. On this channel, there are so many videos about different illnesses. You can watch all those videos, and if you want me to upload a video about some specific illness for which you cannot find the video, you can ask me in the comment section, and if I find a time, I'll try to upload a video about your specific illness. Thanks for watching this video. See you in next video. Bye for now.